Okay. Good morning, everyone. This is Lindy. I'm the policy director here at the East Bay Leadership Council. Most of you know me very well, and most of you are pretty familiar with Zoom since this isn't our first Zoom meeting. So I won't go over all of our controls, but if anyone has any questions, please feel free to use the chat. Happy to answer those as we go along. I'm going to quickly turn it over to Ashley and Cindy, our co-chairs, to lead us in the meeting. I believe we're going to begin with a round of introductions and giving people an opportunity to talk about kind of what they've been experiencing and do some member updates. And then I have a few slides to just go over the May revise, really just some high level things. And then I know we were hoping to have a bit of a discussion about how the May revise might be impacting some of you specifically and some of your organizations. And then at around 10 o'clock, Melissa Stafford Jones from the Lesher Foundation is going to join us to talk about the nonprofit survey that was shared with the EVLC Board of Directors a few weeks ago in May, and to just give us a little bit of an update about kind of reception of that and to hopefully have a further discussion about kind of some of those results and what possibly the EVLC could be involved in. I do have a few quick policy updates, but I think I'll go over those as we possibly reach them here in this meeting. Primarily, I wanted to mention that the East Bay Leadership Council has written some letters to the budget subcommittees regarding some of the budget cuts that have been proposed around adult day centers and some of the programs that many of us are familiar with thanks to WTOE. So if anyone's interested in those letters, I'd be happy to share them. And if anyone has any policy or advocacy suggestions they'd like to bring up here in this meeting, we're certainly looking forward to hearing that. The only other thing I wanted to mention for the EVLC side of the shop is that tomorrow is our live streamed housing event with Connor Doherty. It should be a really interesting discussion. It's totally free. We're live streaming it on Facebook and YouTube. So if you have a moment to chime in on that, it's only going to be about an hour, and there'll be a discussion between Kristen and Connor, but we're also going to be taking a lot of questions from the audience. So I hope many of you will join us. It's definitely going to be interesting to hear some of his thoughts and perspectives on Lafayette, which is actually a part of the book that he wrote. So with that all said, I'm going to hand it over to Ashley, and it looks like Cindy stepped away for a second, so perhaps Ashley can start us off. I have unmuted you, Ashley, but I think you'll probably have to unmute yourself as well.
Good morning, everybody. It's good to see all of your faces via Zoom. Some of you I work with directly, Stephanie, so it's nice to see your face, especially. I will let Stephanie do our update. I provided an update for John Muir Health last time, but essentially we're starting to resume services at John Muir Health and looking to provide safe care to the community, and we're trying to help the consumers and patients in Contra Costa County, Alameda County, and Solano County that we serve recognize the importance of receiving care at the right time, despite what fears they may have. So I'll let Stephanie provide an update on the work we're doing with the safety net. I know that's important to this group.
Did you want me to do it now? I missed my cue. So I'm Stephanie Rivera. I'm the Director for Community Health Improvement at John Muir Health and one of Ashley's colleagues. It's good to see everybody's face today. As we all know, and as you'll hear Melissa talk a little bit more at 10 o'clock, our nonprofit safety net groups are just hurting very badly. So what we've done is we've really pivoted to do telehealth visits for our vulnerable. We usually do the mobile health clinic, and what we've done is our mobile health clinics have become the testing sites for John Muir Health. So what we've done is we now do we do telehealth visits, and it's not video, it's phone with our residents, and we do this every Wednesday so that our vulnerable population that use the mobile health clinic can continue to get service. And our schedules are filling. I mean, I think people really have been, from what I can see, our patients have been holding off on trying to get some assistance, but we're telling them, no, we're here, this is what we need, and a lot of it is just basic refills and asthma inhalers and those type of things. So we do also test our non-insured patients. We set up a system, so I'm very proud of the work that we're doing in conjunction with the county, and we continue to provide some funding services. So we had some we had some funding mechanisms for sponsoring galas and other events. And we turned that into emergency COVID funding. And we had an application process. And so I think a lot of our nonprofit groups have worked on that. We've really, we focused on food and shelter and specific cancer, people with cancer. And so it's an array of services, and we tried to make sure we were balanced between East, West, and Central County. So we're still here. We're still working with our nonprofits, and at 10:30, we actually are helping convene a community coalition meeting between Central and East County. And Susan Kim is actually, she's the executive director for Family Justice Center. She is going to be our facilitator, but I've worked very closely with Duffy and Susan. So we're excited to bring that coalition together. So if you have any questions, you're welcome to reach out to me. Thank you.
Thank you so much, Stephanie. Cindy, did you want to give a quick update and just introduce yourself as a co-chair of the task force?
Hi, sorry, I'm multitasking. I'm on 2 calls at once.
Oh.
It's like craziness. Anyway, I'm Cindy Hatton, and I'm President and CEO of Hospice of the East Bay and co-chair of this task force. We are, I think, muddling through like everybody else. We've sort of gotten into a rhythm. We are seeing patients in the homes. We have since day one. We are taking care of some COVID patients in their homes. It's been challenging for us getting into skilled nursing facilities and assisted livings because they sort of locked down their buildings, but we've been working with them closely, and we've been able to get a nurse and a home health aide back into those facilities, so that's good. And we're just continuing on. We are going with our 6 thrift shops. We have been trying to figure out with the opening, sort of semi-opening up, what that means. So this Friday, we're going to do a trial curbside shopping. The windows have all the merchandise in them. People can go up and look at the merchandise in the window, and then they can purchase curbside. So we're going to do that Friday and Saturday this week from 11 to 3 at all of our thrift shops, and hopefully learn some things there. We've got everything in place to reopen when we're allowed to, but right now we can't, and so we're going to try that.
Wonderful. Thanks so much, Cindy. If it's okay with you, Cindy and Ashley, I'll just kind of go through people. Perfect. Okay.
Yeah.
Dennis, do you have any update you'd like to share? Sorry, what about you, Bob?
Oh, good morning. Hi, Lindsay. Hi, everybody. Nice to see everybody. Yeah, so, I direct the East Bay Health Workforce Partnership. We've been as busy as ever, trying to make alternative plans, particularly for our summer internship program. Most of the internship program will be virtual. We'll be setting up different seminars each day for the students. We're going to continue to have it. It's going to be shorter. Instead of 6 or 8 weeks, it's probably going to be 2 or 3 weeks for the high school students. The college students will are still on tap to do their internships, but the high school students will be doing virtual seminars. We'll need some volunteers, and anybody who wants to talk about what they do in their jobs and everyday life. We need more topics, hopefully to keep the interest. We've been warned not to make the virtual seminars too long because the attention span of our high school students online is pretty short. But we're working pretty hard. The other piece that we've been working on quite a bit is on the contact tracers and trying to make sure that we get community people who are bilingual hired to the contact tracers. As you know, the county has mostly used furlough employees and are using furloughed employees for that. But as those people go back to work, we'll be putting in more community people for those positions. Some of those positions will be paid for by the federal government, hopefully, and by the state. So we want to make sure that our community people know about the positions. We need to build trust in our community in order to do the tracing. So who better than our own community people? So working with groups like Healthy Richmond and Spark Point and those groups to try to reach out to the community to be hired as contact tracers. So, pretty busy. So that's what we've been up to.
Great, thanks. Bob, if you want to send me any information about trying to recruit for people to be part of those, we're happy to try to put that out on social media and maybe include it in our newsletter as well.
Okay, we'll send you the info.
Perfect, thanks. Okay, what about you, Barbara?
So we did an immediate turnaround at Cal State East Bay and finished up the semester using Zoom. And so I had 14 Zooms in 2 days because I had to evaluate all of my students as well. And it's a big challenge to do classes with 63 students in it on Zoom. But we managed to do it. And one of the challenges that I'm finding with Cal State East Bay and nursing is clinical placements, because hospitals, clinics, and other resources for clinical placements have sort of backed out. They reduce the number of students they're willing to have, and those placements are very difficult to come by. So it's a real challenge in the healthcare industry in terms of nursing education. But otherwise, we're gonna do virtual, I guess, Zoom education again in the fall. That's the plan. And we would have to have permission to actually have a clinical site and have to go through the director of the nursing division at Cal State to do that. So pretty much all the clinical experiences that students really need are on hold at this point. You're on mute, Lindsay.
Sorry about that. I lost my,
Okay, that's
my
okay.
feed there for a second.
No.
Thank you, Barbara. That was great.
Sure.
Charlene, would you mind giving us an update?
Hi, yeah. As Stephanie and Ashley were saying, Kaiser has also restarted a lot of its elective procedures, and working to kind of, I guess, open more things up, more screenings and all of that, because we did put a lot of those things on hold for a while. And then we also we've also started to reach out to some of our community partners just to kind of open the communication to see kind of what they're seeing, what their needs are now, and just kind of, figuring out this new world that we're all in, and seeing what we can do, and where the needs really are, instead of just assuming that we know what they are. So it's been really interesting and eye-opening to be talking to some of our partners at this time. So hopefully things will get back to some more normalcy soon.
Great, thank you. Pete, you're next on my screen.
Good morning, everyone. It just sort of speaks to how long a month is these days. I think I left the last meeting talking about how the county really needed to step up and respond. The nonprofits were struggling pretty mightily, and they did. In the behavioral health contracts, they changed the payment structure in a way that basically saves everybody for Q4. So I think sort of this new normal is something most of us have figured out how to do. A lot of us have half of our work in home visiting, and that's something that responds to Zoom and will respond fairly soon to like meeting in parks and things like that. So I think that business lives. The other half, though, is gathering children and adults in schools and things like that, and that's going to be much more complex. Even if we can start building that back, we don't get paid except for the number of children that we see. So starting back sort of at a lower capacity is going to have problems for the business. I think most of us, though, at this point are recognizing we can muddle through this, but a couple of years of a really bad economy is something that we're now starting to be more thoughtful about and trying to predict and plan for that. So it hasn't been as bad as a lot of us thought, and we have a long road to figure out from here on out. So thank you.
Thank you, Pete. That makes a lot of sense. You know, Dennis is it looks like raising his hand. Dennis,
Yeah.
you have a question?
No, yeah, two things. First, regarding Barbara's comments on the clinicals and the actual roadblocks that are going to be in place for a while, and tying back to some of my thoughts previously on advocacy and, you know, finding serious problems and kind of shooting a pointed gun at them. Barbara, is there any way that as an advocacy group, there are entities that we can talk to help consider this problem and begin working on it in a different capacity? Because you're not the first person that I've heard from with respect to a basically funneling issue with respect to clinicals and across the board on all medical fields.
Yeah.
I think that's really going to be a problem going forward, you know, in 2-3 years down the road when this stuff is backing up. And that's going to happen in a lot of areas, but I think in the healthcare industry, that's a big risk. So I just wanted to throw that one out there. And then secondly,
Yeah.
To all of you that are working in the healthcare field out there, I just wanted to personally thank you for what you're doing. And if I can help in any way to, you know, just reach out, and I'll do whatever I can.
So Dennis, let me respond. I participated in the webinar where Dr. Marshita, the president of Cal State East Bay, addressed these issues. And you know what? These are not new issues. Clinical placement has been a challenge for a very long time, and it faces competition with the community colleges. And it's very difficult to have a clinical placement that you can count on. You sort of need to hope that it's there the next semester for you. I deal with that every semester with the County Community Connect program, where it's fabulous for my students to go. But you know what? They also put limitations on us. They only want us for 6 weeks, and the semester is 18 weeks. And you don't learn enough in a 6-week, one home visit per week experience. And so there are a lot of issues with regard to clinical placement. Also, Cal State is not going to have a fall admission process. They have closed it. So we will not have a new cohort of first semester level nursing students in the fall. And so the trickle down has happened, and the director of the nursing division at Cal State has also put forward reducing the number of students admitted in the future from 126 to, I think, 98. And so I think we're going in the wrong direction, and I think it's going to be a huge issue in the future. Thanks, Dennis.
Thank you. I appreciate both of you chiming in here. I also wanted to mention, Bob made a great suggestion, if everyone could just mention their organization as they begin to talk so that we have some context for where some people are working. I know a lot of us have been meeting together for a long time, but it's good for those of us that are new. So thank you again, Pete, Dennis, and Barbara. The next person I have on here is actually Jacqueline. Jacqueline, do you want to chime in? I can't see your video, but I believe you're on the line. Okay, we'll come back to Jacqueline. Colleen, would you like to give us a quick update from the county?
Sure. Good morning, everyone. Colleen Eisenberg with Contra Costa County Supervisor Karen Mitchoff's office. As I'm sure most of you know, the county's been issuing new shelter-in-place orders about every 2 weeks at this rate. And most recently, we've brought back several things, including construction, summer camps for children of essential workers, certain outdoor recreational activities, and curbside retail. So that's kind of the latest update and kind of where we're at in our reopening process. Our county is a little bit behind the state in general, and we're looking at several indicators around our expanding our testing capacity, having PPE, and adding to our tracing capacity as well. And then kind of a great, I'm just going to do a super brief update, but one of the things that Supervisor Mitchoff specifically is helping to lead with Supervisor Anderson is every Thursday right now, they are holding their ad hoc committee on COVID-19 economic impact and recovery. This week it will be at 1, normally it's at 1:30, and we will be talking actually about religious gatherings and looking at the state's recent guidelines that they issued earlier this week, and kind of bringing that up for discussion. The health officer is always on those calls, as on the committee calls as well. So it's a great opportunity for the community to be able to ask direct questions as we're continuing to try to, as safely as we can, reopen our economy.
Thanks so much, Colleen. Can I ask, was there anything from the Board of Supervisors meeting yesterday that we should kind of keep our eye on, or that?
Yesterday we did, the Board of Supervisors did extend the residential eviction moratorium through July 15th. In terms of commercial, they adjusted that to apply to nonprofits and small businesses, and that will also go through July 15th. The idea being that depending on where we're at that time, the board will be happy to kind of re-examine all the different factors and criteria if it needs to be extended again and what have you. So that was the big thing that came out of yesterday's meeting, kind of in terms of the county, some of the different things we're trying to do to help our residents here.
Wonderful. Thanks so much, Colleen. Okay, I'm moving down. Jacqueline, if you come on, just feel free to shout out and we'll come back to you. Brian, are you on the line?
I am. Good morning.
Good morning. Would you like a quick introduction?
Sure. This is my first time being a part of this group. I'm actually a business consultant. I work with healthcare and life science companies to grow top line revenue. The company is, or the consulting firm is, the To Go Group, and many of you may know Jody Avina. So I work with Jody, and it was her that suggested, it was she that suggested that I attend this webinar just to get a feel for it and see what's going on in the healthcare community.
Thank you so much. Well, we appreciate you being here. We hope that it's informative and interesting, and we very much welcome you. Okay, moving on. Tara Kopp, are you on the line, Tara?
Hi, I am on the line.
Good morning.
Can you hear me?
Giving us a quick introduction? Yeah, we can.
Great. Good morning. I don't think I've been with this task force yet. My name is Tara Kopp. I'm with Congressman Mark DeSaulnier's office. And I think on a federal level, the big update is that the House passed the HEROES Act, and it will go over to the Senate. We expect it to look different than it does right now. There's a lot of, big numbers in it. But, once the Senate kind of has their turn with it, we expect that to, change. And we'll see how that goes. I know a lot of organizations have an eye on the state budget right now. And we're just working on a federal level to keep, making sure that everybody, that we're working for all the residents and all the constituents in California 11. The congressman is still in Washington, D.C. He released a video yesterday. If anyone wants to take a look at it, we finally all got to see him and hear his voice on social. So that was nice. And thank you everyone for all of your work and the great information.
Thank you, Tara. I know it was wonderful to get to see him. Can I ask, are you guys hearing a lot about how that HEROES Act is proceeding in the other house?
Not yet. There's not a lot of updates that I have on it right now. you know, it's we're just kind of just waiting and seeing how it looks. Like I said, we definitely don't expect it to look the same, but we'll see.
Absolutely. Okay. Well, thank you again for being here, Tara. It's great to have you.
Thank you.
Tamika is on the line. Tamika, if you can unmute and say hello, that's wonderful. If not, Jacqueline actually sent a quick message to me just letting me know that she's happy to be here. She's having some trouble unmuting, but that she has similar updates to Kaiser and John Muir, and that they're starting to be able to serve more people and trying to get the word out that you can come into the hospital when you need to. Okay, and I see that Melissa is on the line. Melissa Stafford Jones, I know that you're here, but I don't see you, so it's possible that you're still working on some things, but I just wanted to mention that she's here. Melissa, did you want to say anything in regards to updates? Oh, hi.
Good morning. I'm here. I'm multitasking. Melissa Stafford Jones with the Dean and Margaret Lesher Foundation. No, I'll say when I share my slides, I'll give a little bit of update. I think that's the bulk of what I wanted to share with the group today. So when it's time for that, I know you'll let me know.
Perfect. All right. Thank you so much. And there is someone here who's called in, but unfortunately because they called in, I can't see who they are. But is there anyone else who wanted to give any update before we move forward?
Hi, this is...
Oh, it cut out there a little bit. This is who?
Patience.
Oh, hi, Patience. Oh, I'm sorry, Patience. Your little square moved in my lovely Hollywood squares. Would you like to give an update?
There you go. Yes, my name is Anton with the Workforce Development Board of Contra Costa County. I am happy to join this call today. My board member, Ashley, is on this call of committee, so I'm excited to see her and some of you. It's actually my first time calling into the health, this healthcare task force. I normally am with the Economic Development Task Force, and I find the conversation interesting. At this point, the Workforce Board is trying to be around in as many committees as we can get information from and share with, so that we can pass on the information to our community. We are doing a whole lot of work right now at the Workforce Board to gather resources for businesses and job seekers. So any opportunity for us to get information that we can share with the job seekers and businesses and partners we work with, that's actually our priority at this time. So if any of you has a minute, just go to WDBCCC, our website. On the front page right there, you're gonna see all the resources that we have for your, the businesses that you work with, including a workshop that we have coming up on the 16th to help people get back to work. Businesses get people back to work. So thank you for having me. I look forward to listening.
Thank you for being here, Patience. It's always wonderful to see you, and we appreciate you joining this task force. As you said, we normally see you at Economic Development. So I think that has summed up our member updates. Cindy and Ashley, I'm happy to proceed with talking a little bit about the May revise, but is there anything you wanted to mention before we move on to that?
No, Lindy, I think it's great if you want to give a budget update.
Sweet. Okay, I'm going to share my screen, so give me 1 second to do that. Okay, hopefully everyone is seeing some slides. The bottom line here is, and I put this cute little graphic in the beginning, but this is where we're really going to start. The bottom line is that there's an estimated $54 billion shortfall. We've been hearing that number a lot since the May revise came out. There's also been a good handful of articles that have come out about people kind of debating and having different ideas about whether or not that's a correct estimate. We understand that the LAO even has had, the Legislative Analyst's Office of the state has had some conversations about some of their projections and some of their views about where exactly this number is coming from. But I wanted to give everyone a little bit of context. So the shortfall is essentially coming from an estimated decreased revenue. The largest chunk of that is in personal income tax. One of the things we've talked about here at the East Bay Leadership Council is about how California's reliance on income tax can make budgeting quite challenging, and that long-term that might be something worth looking at. It will be interesting to see whether or not COVID and the response to COVID leads to any conversations about that and just our heavy reliance here in California on income tax. $10 billion in sales and use tax reductions. This is something we're hearing a lot from states and cities about how the sales tax reduction is going to impact them, but of course it also impacts the state. And then $5 billion in corporate tax reduction. So when we talk about that $54 billion, I just wanted to kind of explain this is primarily where the state is estimating that shortfall is coming from. The revised budget proposes cuts or reductions, depending on kind of how you use it and what word you prefer. And I wanted to just lay out the majority of those. This isn't all of them. And of course, it doesn't get into specifics, but if anyone is interested, I recommend the Cal Budget Center did a wonderful breakdown. We have some other articles and information we're happy to share and send if anyone's looking for some specifics or details here. The most primary one on this page is that we're obviously going to be drawing down on reserves. There's been a lot of conversation in the legislature this week about what other aspects of or other opportunities for new revenue might exist. I know a handful of assembly members, for example, have been sending out surveys or even asking in social media what their constituents would think about different things, including like a vaping tax or a change to corporate tax structure. So I think we're certainly going to be seeing some of those conversations continue. But in the budget, the suggestion was mostly around businesses and what they can use their tax credits for, the amount they can use their tax credits towards. There's also a lot of conversation about federal funds. Some of that is already in this, the state already has the ability to use. So $8.3 billion of funding that comes from the CARES Act is going to be used to help to fill the shortfall. But there's also an anticipation of about $14 billion. If that doesn't come, and unfortunately the federal government isn't in a place to provide further support or chooses not to, there are what are called trigger cuts. My understanding from my reading and analysis is that these trigger cuts will happen regardless of what is given from the federal government unless it meets that $14 billion. So if the federal government says, here's $1 billion, it won't stop these trigger cuts. So it'll be interesting to see how the conversation continues around those. Those are somewhat more specific, and I didn't put any details here because, again, I think that there's a lot to look at and we're not quite sure what will come out. But if anyone is interested, happy to send them some details. This is where we've been seeing some advocacy as well in the last few weeks, because some of these, I should say the last week, because some of these cuts are going to be pretty detrimental to programs. It's also unfortunate to see that a lot of the things that changes that have been proposed in January that people were very hopeful about are not going to be happening, which I know is somewhat unfortunate. So that's a quick overview. I wanted to just do kind of high level budget discussion there, but I wanted to kind of open it up because I know that people are certainly interested in more specifics than I covered there. And maybe I can hand it again over to Ashley and Cindy to begin to facilitate that conversation.
Thank you, Lindy. I think that provided helpful context. And from a health system hospital perspective, we have concerns over a lot of the cuts to hospitals and payments that we see, especially in light of COVID-19 and a lot of the lost revenue that we've seen. So in particular, things as small as programs like Song-Brown funding for our primary care residency program to inpatient Medi-Cal managed care payments. And so I think there's a lot on the table that puts our health system at further risk of financial losses. So we're paying attention to it, especially given everything going on. I think it's important for us to be advocates for our health systems locally, but also for our safety net, who also has impacts. So all things we're watching and writing letters on and talking to people about, but in the current climate, there's certainly a lot to be concerned about.
Thank you, Ashley. Yeah, and if there's any letters specifically that we can sign on to, I'm happy to distribute that to this group and to proceed forward, especially something like residency, which I think aligns very well with the policy agenda that this task force has already passed, and really trying to increase primary care residency, but residency in general, and to support our healthcare workforce. I think would be certainly something EBLC would be happy to sign on to.
Great. Thanks, Lindy.
And I would say for home health and hospice, home health has an automatic, we finally got an automatic cost of living put in, and there's a question about the funding being cut for home health, and home health's margins are very, very tight. Hospice, we're watching to see what the implications are for it on a state level, more on the Medi-Cal side. I know that probably most of you, Debbie's not on the call, but I'll speak for her. They have a huge, the daycare centers, Debbie has sent out information, given you some great talking points on, if you'll go on her website. And then she also is doing I think it's called Dishing with Debbie or something on Thursdays, but she'll update you. But it's really important because they're cutting those funds. I mean, like totally cutting the funds. And so that's a big problem because those daycare centers, Debbie's and others, are the safety nets for patients to stay out of nursing homes and to be able to have a place to go and thrive with their programs. And so that's one that's a big concern.
Thank you, Cindy. I also just want to add that we sent 2 letters that Debbie gave us some language for. The first is, as Cindy just mentioned, around adult day healthcare centers, but also around their program that allows a social worker to be heavily involved with some of their clients. It really helped to kind of coordinate and facilitate in hopes of keeping that person out of a full-time care center or nursing home. My understanding is that that is also proposed to be completely eliminated and cut, which is, as you can imagine, certainly unfortunate, but also Debbie has really been an advocate for saying that that doesn't make sense from a cost or health perspective. My understanding is that Assemblymember Jim Wood has also taken this up and is quite passionate about trying to really relook at those cuts. If anyone would like those letters, please let me know. I'm happy to forward them all.
I think just to follow up on what Ashley and Cindy said, I think it's really important to look at what's happening here, and also what Barbara said about nursing programs being suspended in the fall. I've heard this across many colleges and community colleges. We're going to have a workforce shortage, and we talk about, the short-term effect of COVID, but also the long-term effect of our economy. We can't stop the health workforce programs. Ashley talked about the cuts in Song Brown, the residency programs. This is really serious, and the governor, although we don't have specifics yet, but certainly there's a hard look at cutting a lot of the health workforce programs, which, might help us a little here financially, but in the long run, it's really going to hurt our health workforce programs, our colleges, our programs, and we'll end up with, incredible health shortages in terms of qualified people, primary care delivery, down the road in another 2, 3, 4 years. So I think we really have to look carefully and do whatever we can to hopefully make sure that the elected officials understand that the actions that they take, although short-term now, have really long-term consequences in the health workforce.
I might also add, Bob, that because of the unknown in terms of the pandemic and clinical placements, it was the error on the side of caution for these new admissions to the nursing program. And I don't know, my gut tells me that came down really fast, and I wish that we could take it back. I didn't make that decision, but when you need 50% of your clinical hours hands-on and you don't have the hands-on, you're taking a risk with these students' lives and careers as well. Very difficult decision to make.
Right. And it's not just the nursing students. It's all
Right.
the allied health students, that they're rad techs, they're medical assistants, and all the people that are going to be so critical to us as we move forward in another year or two.
You're right.
You bring up a good point, and Lindy, I don't know if you have more information. I've been so hyper-focused on hospital and health system related cuts, but mental health, homelessness, what are you looking at in terms of the budget and the impacts to programs in those areas?
So the governor, when it comes to homelessness, has been pretty careful, as I know we've talked about here, about ongoing funding. So some of the things he had proposed are no longer on the table. But my understanding is that there haven't been specific cuts to homeless service funding because, again, there hadn't really been increases there. They had been more like one-time fundings that had come down the last few years. There is, however, through COVID-19 emergency funding, the buying of motels, which we may see, be a benefit to some communities where those hotels are bought long-term. I think that that's somewhat yet to be seen. Obviously, there's also just some increased funding around for homeless services providers to be able to provide things like porta potties and cleaning stations and things like that that have come down through what is considered COVID-19 emergency funding. In regards to behavioral health and mental health, we've been monitoring some bills. I hope to mention today, I hope to mention today 803, which was the peer support specialist bill that this task force has supported. It's one of the few bills that continues to stay alive. And so we've been monitoring those bills, but in regards to the budget, there hasn't been a lot of attention given to any cuts to mental health, which in some ways indicates that that's a positive thing, because if they were particularly severe, we'd certainly be hearing about it. But I'm happy to look into that specifically more.
Yeah, I think one of the things that we're seeing with everything going on, whether it's as a result of shelter in place or job cuts or anything happening during this time, I think mental health has not been as big of a focus as it should have been, at least early on while we were concerned about the pandemic itself. And so I think we're going to see an increase in mental health services that are required to support our community. And so to the extent that that is funded and cared about, we're going to be paying attention to it.
Absolutely.
So this is Stephanie, and so this is a bit tangential to the group, but I wanted just to give a heads up. I was on a call, and as you know, for nonprofit community hospitals, we're regulated by the 501R regulations at the federal level for nonprofit status. And they're usually very clear. Anything operational is not considered a community benefit. And recently we were informed that that's actually changed. COVID-19 expenses for hospitals will now be considered community benefits. So Lindsay, maybe what I'll do is send you the slide deck. From a policy perspective, this is a huge federal change.
Yeah, absolutely.
And they actually called out SB 1152 as well, and said that because the rest of the country allows for clothing pantries in ER rooms to be considered a community benefit, they're allowing California hospitals, even though SB 1152 passed. So those are some, I mean, in the hospital world, that's a big deal.
Yeah.
Because it allows us to capture activities that we normally would not capture and would be considered part of operations. So I'll send you the slide deck and
yeah, absolutely.
Legal perspective on it. So
I can also, if it's okay with you, Stephanie, or whoever put together this slide deck, I can put it on our resource hub too for anyone who might be interested in.
Yeah, it was a federal. It was the federal update for what we can start counting. So
perfect. That's wonderful. Thank you. Yeah. Did anyone else want to weigh in on the budget? Okay.
I don't know how much, and maybe this is something I should talk to Rebecca Rosen about, but in our discussion with the CARES, Contra Costa CARES program, there was discussion about going to an appropriations committee, and I guess given where we're at, and we were going to ask for funding as a county. I don't know, Lindy, if you are up on that at all, or Ashley.
Do you know if Rebecca was talking or had mentioned at all that being in a conversation in conjunction with the sales tax conversation?
That was one avenue with the sales tax. There was another proposal on the table that and to go to an appropriations committee to ask for funding for the CARES program. And
they were looking at it as kind of a pilot program and a demonstration program to see if we could get support for CARES in the county. Stephanie, I don't believe that's moving forward, just given everything going on with the budget and also cuts to Medi-Cal.
Okay. I thought I'd ask. You know.
Yeah. Good question.
Yeah, thank you. And we're definitely trying to keep an eye on this sales tax conversation. It actually was at the Board of Supervisors yesterday, but just to accept a report. So I think we'll have a better sense as we get a little closer to the election about whether or not that's actually something the county is going to pursue. And should they, I'm sure there'll be lots of further conversations about some of the potential allocations for that money. Though I should say that if they do move forward, it will be they're going to be going for a general sales tax.
Right.
So it wouldn't be specifically allocated.
Right.
I also, sorry, go
quick
ahead.
update as to what happened yesterday regarding the kind of the sales tax conversation at the Board of Supervisors meeting. They just accepted the assessment report. They were looking, the committee that's kind of been put together to work on it is going to be coming back with a polling proposal for later on this year. So that will be coming back to board.
Is that a polling proposal that would be funded by the board, or a polling proposal that'll be funded elsewhere? Do you know?
They, based on the direction from yesterday, it'll, there should probably be a couple different combinations, if you will, for the board to look at.
Okay.
The idea.
Thanks, Colleen. I noticed Debbie has joined us. Debbie, I just want to let you know, Cindy was quick to mention some of the thoughts you have on the May revise, but we've been discussing the budget. Do you want to chime in there?
Why, yes. Thank you, Cindy. I have
I
some
mentioned the
thoughts.
letters that we had sent, so just so you know, we've given a little
What's
bit of
that?
context. I did mention the letters that EVLC had sent to the budget subcommittees.
Yeah, and it's now time to go to the, I think the almighty four, right? I think we're, plus the governor. I think it's messaging to the governor, but it's also to Holly Mitchell, Tony Atkins, Anthony Rendon, and Phil Ting. Those are, I think, you can tell me I'm wrong. You're way more politically savvy than I am, but those are, I think, the folks who are going to end up in conference committee, assuming that they do conference committee. I think we're not really certain. This is such a different year than any other year we've seen. We saw the entire assembly meet as a whole yesterday, which we don't normally see at this time during the budget process. It's just budget subcommittees then meeting with the budget committee, and then it goes to conference committee. And so we're just seeing some different stuff. I know that Senate budget is meeting tomorrow, and we don't even know if they're going to be voting on stuff or not. I think all we really know is that they're supposed to, if they want to get paid, have a budget to the governor by June 15th. Like, that much we know. What I can tell you is I just got off with all the ledge staffers in Sacramento, which is why I was not here. And there is no coordination happening from the administration with ledge staff, and it's extremely frustrating and disappointing for them. And it's just a wild kind of a process, and there seems to be a lack of just coordination, conversation, and things being thrown by the administration. And so there's a lot of turmoil happening there. There's a proposal to eliminate adult day healthcare and the multi-purpose senior services program. And for those of you who have been listening to me for years, that's what we do. It's 80% of what we do. So we have the multi-purpose senior services program as a complex case management program. It's a nurse and social worker team that go into the homes of people who are 65 and older on Medi-Cal with no share of cost, who are at a skilled nursing level of care. That is to say that Medi-Cal would pay to have them in a skilled nursing facility today. And that team assesses their home environment, their psychosocial needs, their physical needs, and puts together a plan that includes getting them to and from doctor's appointments, medication administration, connecting them to specialists, liaising with their health team, also getting them in-home support service workers, training them, pest eradication, widening hallways. Like, we have a pot of money where we can pay for a PG&E bill, or if their refrigerator dies, get a new one, hook them up to food, a blender, a warm blanket. Like, there's this, it's a Medi-Cal waiver program, so we can spend money on things that you can't normally spend money on in Medicaid. And it's been around for 40 years, and it's kept the frailest, most elderly and poor people out of skilled nursing facilities successfully for 40 years. That was a specific blank spot there for me not to say a bad word. Anyway, so that's MSSP, and there are 12,000 people served annually in that program throughout the state. And then the adult day healthcare program that's being eliminated, for those of you who haven't been to our center, it's a skilled nursing facility staff put into a day program context. So think of a senior center with a skilled nursing facility staffing. So they're just coming for the day. We design the activities around what people's preferences are, but also to meet whatever their health needs are. So we're doing a lot of therapies there that we disguise as fun. And we have horticultural therapy and pet therapy and physical therapy and occupational therapy and nursing and all this stuff. And we keep them living at home, and we provide respite for their caregivers, and we provide education for their caregivers and support group for their caregivers and transportation. and blah, 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 blah. So these, and 37,000 people are served statewide in these adult day healthcare programs. So between the two, we are pulling out the last vestige of the safety net for people, 50,000 people statewide who are at the greatest risk of skilled nursing home placement where people are dying from COVID. And it's for very little, it's budget dust. MSSP is 22,000 or 22 million, and it brings down the exact match from the federal government. Like, these things are truly insane right now. And Friday at the last hour, they called together the Master Plan for Aging Stakeholder Advisory Committee with 2 hours notice to have a special meeting so that they could present us with a new benefit that was going to replace adult day healthcare and MSSP statewide. And they wanted to present it to the budget subcommittee that met on Sunday. And thank God Chair Pan saw right through all of that and asked all the right questions. Like, really, you're going to stand up a brand new benefit statewide by January, but you're eliminating these programs in July, and what's going to happen to these people in the interim? And where are you scoring the cost? There's no cost. Like, where are you getting that it's cost neutral and it doesn't cost any money to start? Like, you know, so the right things were happening. But right now, what we really need is for people to call those 4 leaders I mentioned, as well as the governor, and say, this is insane. How can you have a press conference every day where you say seniors are your priority population, and yet you're eliminating the programs that keep the most frail living in their homes safely? Thank you for the opportunity to do my commercial.
Thank you,
Well done.
It sounds like you're having some important conversations, though. You know, that some people are listening and hearing and asking the right questions, as you said. I also wanted to mention, I know in years past, Senator Skinner has sometimes been part of budget conference. Just throwing that out there since she's somewhat of a local connection. I don't know if she'll be part of it this year, but she was last year, and that was part of how we were able to get the Naval Weapons Station and Concord as possibly included in that study. Going a little bit.
Yeah.
But
so I reached out to Margaret, her district director, and so I hope to have this conversation with her. So if,
Great. Yeah, that's good to hear. You're on top of it.
I'm trying. I can tell you that I haven't slept much, but yeah, a lot of us are working literally around the clock. And that's the nature of this, like, our world serving really poor, frail elders, is that we don't get paid what it costs us to provide the services. So we don't have lobbyists, and we don't have big organizations that are in Sacramento. So it's us. There's like 6 to 12 women who work round the clock and create all the materials and do all the press and do all the relationships and do all the everything to try and save the programs. And this is it's not a new song, unfortunately.
Well, thank you. Okay, I think that was a great discussion. Again, if anyone has letters they're specifically working on or want considered by the group, I'm happy to send emails out. And or it's possible it already aligns with the policy agenda and we can just somewhat proceed. So, which is kind of what we did with Debbie's request towards the budget subcommittees. We also recognize that timing is a bit unique this year. And so we're trying to adjust to that as well. I did want to mention 803, which I mentioned a little bit earlier. If anyone's interested in that, June 1st is the next hearing on it. So we'll know at our next healthcare task force if it's continuing to move forward. But as of right now, it's still alive. So just wanted to make sure everyone was aware of that. I also wanted to share that I'm going to be having conversations in the next few weeks with some members of different organizations throughout the county, including Contra Costa Health Leads, who are looking at whether or not a community information exchange is something that has value here in Contra Costa County. You may have heard about little conversations that are happening around this. Here in Contra Costa County, we have 211, which is a wonderful space for resources, but it doesn't function as a community information exchange in the same way that some do in other parts of the state, and as far as we know, other parts of the nation, where it really serves as more like a one-stop intake. So I just wanted to kind of give everyone some information that is a conversation that's beginning to happen here in Contra Costa County, and that I hope to keep you all updated as that conversation continues. If anyone is specifically interested in this, I'm happy to loop you into the meetings that I plan to have in early June to try to understand kind of what the approach and thoughts are, and it's possible we might invite 211.
I'm super interested in that conversation, but I can't before June 15th. So, but I'm super interested in that. I will tell you that I've been heartened to see the attention and support go to 211 during this time so that we can really build up and have that kind of up-to-date, well-managed resource for people who need. I mean, this pandemic highlights all the gaps, right? And it also highlights all the amazing heroes that we have in our community. And we have a lot of unsung heroes in John Muir, in the county health services. Like there are just heroes percolating up. And I think that to be able to capitalize on that, capture that, and really build up 211 so that when this happens again, everybody already knows where to go and it's like turnkey, right? I think that would be brilliant.
Thanks, Debbie. I appreciate you chiming in on that. Stephanie, I saw you unmute yourself. Did you want to chime in as well?
No, I'm working on the committee as well with on the social determinants of health with Duffy Newman, and we've looked at various there's various applications out there, but this is something we're really interested in, and so I'm happy to work with you on that. I think there's a lot of potential there, but of course a lot of it is about resources. So, but there are models that I think give me a lot of hope.
Absolutely.
A very much needed thing and very doable. So.
Yeah, I certainly, from my very limited looking into this and research, understand that it's also very important that the nonprofits in our community and those that are seen as resources also buy into it, right? And
right.
want to be part of it. So that's certainly something to continue to explore. But yeah, Stephanie brings up a great point, which is that in the county's social impacts task force around COVID-19, this has been a big part of their discussion as well. So certainly not something that's living just here at EDLC.
Yeah, I think there's a one-page, Lindy, I don't know if you have the one-page summary on kind of the objectives of how it's being approached. I'm happy to send that over to you. It's just about the centralized
yeah, I have a few things from Mary, but sure, feel free to send that over because just in case I don't have it, I'd rather have it's than not enough.
Okay.
Thanks, Stephanie. Okay, well, Cindy and Ashley, if it's okay with both of you, I think that we could maybe take this time to turn it over to Melissa Stafford Jones to talk us through the survey and the survey results, and hopefully for us to give some feedback and share some thoughts. So, does that work for you, Cindy and Ashley?
Perfect.
Wonderful. Okay. So thank you so much for being here, Melissa. It's always so wonderful to see you. Melissa actually gave this presentation to the board at the East Bay Leadership Council, and many of our board members said we need to continue this conversation. And so part of that was how it ended up here at the Healthcare Task Force. We'd love to get some of your thoughts and input, but also maybe just think about how we can be helpful, which is something the board just during our board meeting didn't have a ton of time to reflect on.
Thanks so much, and I really appreciate the opportunity to be with all of you today. I'm also a member of the East Bay Leadership Council board, and I mostly participate in the talent and education task force because of some of the work of the foundation, but I'm really appreciative of the opportunity to be with you all today. I'm going to share my screen in a minute, but the Sanford Institute of Philanthropy at John F. Kennedy University led this survey in partnership and with support from 4 foundations, including the Lesher Foundation, the Soda Foundation, East Bay Community Foundation, and San Francisco Foundation. What I really want to do is I'm going to fly through, I hope pretty quickly, the findings because, you know, sadly what I would say about them is they are not surprising, but they are startling. It reminds me a little bit, I don't know if you guys, you know that sometimes when you're at, you know, meetings or whatever, people use that iceberg graphic where you can see sort of the tip of the iceberg and they talk about how all the root cause issues are under the water. With our work on COVID, I just have this like visualization of that the iceberg has just lifted up dramatically. So as Debbie was saying, it's all the same issues that already existed. It's just they're exacerbated and they're so much more visible to more people. And I think that's what we see in the survey findings. So we did the survey in mid-April. So it is a snapshot of a moment in time that's about a month old. We analyzed the data, and then we've been doing meetings like this. We call them kitchen cabinet discussions, where we've really been trying to just reach out to a variety of leaders in the community and get them talking and thinking about and really helping to make meaning and grounding the findings in the reality, because things have changed in the last month. A lot of things have shifted, although I think some of the themes really remain. So I want to kind of fly through the findings and then get to some of the discussion questions. So let me share my screen and hope that that all works. Okay. So I've told you a little bit about this survey. And just as a note, so when we did the survey, the shelter had been in place 4 to 6 weeks. So we didn't capture that sort of initial 1 to 2 weeks of work. This is sort of where people were at, and you can see the number of nonprofits that participated. And this included both Alameda and Contra Costa. All of these first slides that I'm not going to go through essentially give you background on the nonprofits themselves that participated in the survey. So Lindy has these slides. She can absolutely send them to any of you, but at least based on the meetings we've had to date, this is not where people have a lot of ahas. I think it's a decently, imperfectly, but decently representative sample of community-based nonprofits in the East Bay. There is a question of whether there's enough truly very small nonprofits represented, and that's always a challenge with surveys, is getting the truly small nonprofits that have less infrastructure to be able to complete surveys. So I'm going to focus on the slides that talk about impact on community and impact on nonprofits themselves. So a few things to note here. So this is probably the slide for me that every time I look at these, I just really have to take a deep breath, because this question to nonprofits was about the impact on the clients and communities they served. And the question was worded to specifically ask them to utilize the perspectives of their frontline staff or frontline volunteers. And what you can see here is that 90% of respondents said that their clients are at extreme or high risk. And you can see the definition, with extreme being health and welfare at immediate risk. And I think most concerning is the sense of nonprofits in working with their communities that that category of extreme risk increases dramatically from 19 to 32% is what they project in the next 3 to 6 months. That as hard as things have been, the longer term impact on clients and communities is expected to worsen, particularly in this extreme category. So I think that's just something we really have to take in and sit with. Again, not surprising, but it's just, it's very, very deep and significant. I think what you can see from this slide is really all people are affected, right? We know that all people in our community are affected by COVID. It leaves no individual or family or community untouched, but obviously there are some groups that are more deeply affected. Including different age groups, but also people of color, immigrants and refugees. So you can see that here. I want to pause on this slide and connect on something from the earlier discussion as well. I mean, I think obviously the first 3, unemployment, food insecurity, and housing insecurity, are what I think have gotten the most discussion and effort and work, and rightly so, given how high these numbers are. I mean, I don't think we can undervalue the importance of this #1 bar here being unemployment and the impact that's going to have, since many of the jobs of the people who are unemployed, particularly workers who are under $40,000 or $50,000 a year, are jobs that are either not going to come back or going to come back differently or might come back with less hours. And so this is just really an important place where there's been work done in terms of response, but in terms of recovery and reimagining for the future, this is obviously a huge area. But I do want to note this 4th bullet of mental health, because I know that came up earlier in the discussion. And at least my sense, and this is something I'd love to hear discussion about, is mental health comes up in a lot of meetings and conversations that I'm in, but I'm not sure there's been as much coordinated, planful, intentional work and effort around it as maybe some of the work on, say, food insecurity or other things. So, but I do think it's worth noting that it is the 4th highest in terms of impact. And then in terms of impact on nonprofits, we asked this same question in terms of impact: extreme, high, moderate, or low. And you can see here, I mean, it's about 80%. So 80% of nonprofits said the impact on them from an organizational perspective is high or extreme. The survey results at this moment in time seem to find that those numbers stay relatively static in 3 to 6 months. I will say that in the subsequent sort of these kitchen cabinet kinds of meetings and discussions we've been having, I think people feel, we've had a request that we do this survey again in late summer, early fall. I think there's a sense that this will change, that this is reflective of the snapshot in mid-April where maybe the full sort of sensibility of the depth of the impact of COVID hadn't fully hit people. And I know I was on some calls yesterday where several nonprofit leaders noted they're increasingly even more concerned about 21-22 than 2021 from sort of an organizational sustainability perspective. So I think the longer term horizon may be even more concerning for nonprofits. I think we'll have to see, but this is what the survey told us during that snapshot in April. I think you can see here, some of the particular financial impacts on nonprofits, which come from a variety of sources in terms of what's impacting them. Those with earned revenue in many cases, particularly in government contracts, have shared that they are struggling for a variety of reasons, but in some cases, I think government funding has been maybe less flexible than other kinds of funding. But I think this second bullet about cash flow is an incredibly important one that we need to pay attention to for our nonprofit community and really think about how we're going to address that. But overall, the entirety of just, tremendous financial impact that's threatening sustainability. You can see these programming disruptions. I think these are all things that you might expect, but when you see the percentages there, it's also clear how incredibly disruptive, of course, this has been to the work of nonprofits and their ability to serve their communities. In terms of nonprofits themselves, I think these, the first two bullets are really important, and maybe even the first three to note here. I mean, one is what nonprofits said was the dependent care commitments of their own staff, whether that's elder care or child care, caring for a disabled family member, are really impacting their staff's ability to do their work. And I actually spoke with a nonprofit leader earlier this week who shared that part of their reopening plan is around their staff's availability and capacity because dependent care is just such a significant issue. We know about the decrease in the volunteer workforce, which is partly related to age, that many of our volunteers are older and will be have been sheltering in place and maybe for longer. And also the digital divide was really evident throughout the survey in various questions, including here in terms of the ability to work remotely. We also did try to ask nonprofits about some of the ways things are changing and the ways they feel like they're really contributing to the response. And I think one of the things we really heard here is that nonprofits are doing more, and they're doing even more different things than they would do, some of which are sustainable in the longer term potentially, and some are not. I think many are providing direct services, and this question was really around direct services beyond what they would normally provide in essence. So they're doing different things or additional services than they would otherwise do. I think particularly around food. Many organizations that work with individuals and families have really stepped up to work on access to food, even though they don't really do food work because it's been just such a tremendous need. I think also a number of folks have been struck by the next couple of bullets around the increased coordination. We've heard that from many of our nonprofit leaders, that they are really seeing a need and leaning into that work of deepening coordination with their fellow nonprofits, but also engaging with local officials and in local advocacy efforts to try to address the impacts on their communities. Nonprofits expressed a fair amount of confidence in their board's capability to work through this crisis and think about the future of the organization and lead it during this time. Not surprising that, I think fundraising almost always comes up, COVID or not, as the #1 capacity building need for nonprofits. And I should say the way this question was worded is important. They could essentially rank order a series of capacity building needs, and these were which ones they ranked #1. So actually, when you look at fundraising and contingency planning, for example, who ranked it 1, 2, and 3, these are even closer together. So I think contingency planning is also incredibly important to nonprofits from what we heard in this survey. These were some of the assets that nonprofits felt they brought to the table and could potentially share with their nonprofit partners. These are some bright spots that I've actually mentioned along the way. And then some examples of the collaboration that's happening. And then I really want to get to this slide, which is this discussion. And we don't have to go in this order, but if there are particular findings that stood out to you, if you think there are specific implications for business or government or healthcare in light of this task force focus, and if you think there are recommendations. We are working right now actually on we've been sharing these slides, but we're working on a report that will combine the findings with key implications and some calls to actions based on all of these kitchen cabinet discussions that we've been having, as well as the findings from the survey data itself. So let me stop there and Lindy, just open it up for folks to weigh in on any of these discussion questions or anything else about the survey itself that struck you as important or that you'd want to have a discussion about.
Thank you, Melissa. I think that these are great questions, and I hope that others will chime in with their thoughts. I did have a quick question. I'm curious, the events seem to have, or lack of events seems to have had a pretty large impact. I'm just curious if you've heard from many nonprofits who've seen these results or just since about holding digital events and whether they've had any success with that.
Yes, we have actually, and that came up in some of the discussions we've had thus far. I think some folks are seeing some success with virtual events, and so people are working on those. I also think there's a sense that we don't necessarily know if that will continue over time. So how do we sort of figure out what the best practices for longer term virtual fundraising might look like, since we're sort of in this moment of crisis and people might be stepping into that. And there's nonprofit leaders on this call who might be able to weigh in more thoughtfully than I can on that. And then I think the other feedback we heard was that isn't necessarily consistent across types of nonprofits. There was particular concern expressed on some of the calls around for the smaller nonprofits, whether that would be true, who may not have the capacity to do large events in the first place, and so sort of mounting something virtually, or whether for nonprofits that are deeply community-based or led by people of color, where some of the networks and access to fundraising might be different, if there needs to be more attention paid there. So I think the answer is yes, but that it may be uneven in terms of the success of virtual fundraisers. That's what I feel like we've heard to date.
Got it. That makes sense. Thank you. It's open. I'd love to hear others' thoughts.
I totally agree with that last, Melissa's last response. I think that that organizations like, and Cindy, correct me if I'm wrong, but like hospice, they have their hospice, the East Bay has people who are deeply committed to hospice of the East Bay, and whether or not they go to the Diamonds and Denim fundraiser at the country club or not, they know they're going to donate X amount of dollars every year. And so whether it's online or going in person, they're very committed to that organization, the mission, and what they're doing. So I think in cases like that, where you have developed this allegiance and affinity for your work, particularly if somebody has died in hospice care and it was great care, you are indebted to that organization forever. Like, I think, you know, and then there's the food bank, like they had raised their entire annual budget by March, I want to say, their fundraising budget. So people are aware of food. I think where money goes right now has to do with the establishment, the connection to the mission, the history of the donor, as well as what seems to be the most urgent, pressing issue right now in this pandemic. So I think that's informing the funding. And if you were a poor, scrappy nonprofit prior to this, I don't think that that's going to change as a result of this, unless you're in a lane that people are recognizing, like food, right? For example, I don't think it's as elevated that there's domestic abuse going on, and that when people are sheltering in place at home with their abuser, they're getting more abused right now. Like, I don't think those kinds of things are elevated in the same way. And I could be wrong, but I mean, that's sort of my experience of it. But what I want to say is the other thing that's happening right now with nonprofit organizations is that we don't pay, like, we all know that, right? Unless you're a big nonprofit organization with like huge infrastructure. But if you're serving a really poor, underserved population, chances are your nonprofit doesn't pay well. People going on unemployment right now, or who have kids at home, or who have some COVID related reason that they can not go to work, are getting paid a lot more money to be at home. And so that makes it very hard to continue to provide the services, to get back to the part of the survey that was talking about, like when Melissa was talking about who reopens when, has to do with your staff capacity. You know, we can get PPP loans and try and keep our staff completely whole, but if they find that it's better for them to go off the payroll, they'll go off the payroll. So, I mean, there are a lot of different nuanced things, I think, in running a nonprofit in this time that are different challenging things.
I think you make a great point, Debbie, and I just want to mention that to that, one of the things that EPLC has been exploring is how to really support organizations thinking about the unemployment work share program. Just recognizing that not everyone is going to be in a position to bring everyone back full time, and that might be a resource that has been somewhat underutilized.
Yeah.
Go on, Bob.
Yeah. Just piggybacking on a couple of things that folks have said, it's interesting. This is a point in time, right? And mid-April, there was a whole different sense of crisis, and lots of folks didn't know whether, you know, the PPP loan was sort of had tapped out for a second. So I think that it would be great if you could do this again, because I think the issue is going to be the long-term piece. And to Debbie and a couple other people's point, the inequities in how nonprofits are running is showing up just as it is in the people that they serve. So to the sort of the scrappy nonprofit and the folks that are connected, you know, for a lot of agencies, there are 4 or 5 top donors that do 80% of the support. And those agencies are probably going to be in better shape than those that are relying on a lot of small donations for just the ability to have types of conversations with the people that support you that will keep that going. And this isn't the word, but the feel is, yeah, there are trends and there's sort of fashion right now, food and the things that people at home are thinking, yeah, we should be supporting this. Those are going to get attention. But to Debbie's point, we are dealing with a lot of domestic violence, and that's not showing up yet as part of sort of the larger conversation that we're having to address. And it really does feel like there's a significant slog ahead that's going to change all of this. I think it predicts it in this, but that's going to be more the issue for us.
Thank you, Pete.
And I would say for us, you know, Debbie was talking about, you know, our gala and things like that we do. We had a Giving in the Garden event that was supposed to happen in April. And so they're working right now on trying to figure out how to do virtual, what can we do virtually. You know, and I think that, yeah, there are people who are ongoing donors that support us, but then again, we have a lot of middle of the road, what I would call middle of the road donors that don't donate these huge, you know, millions of dollars, but are, you know, working people who maybe have lost their jobs and are considering, you know, people are really thinking about how they spend their money. And, you know, for us, it's just keeping in touch with our donors. But, you know, we've seen a decrease in our, just our regular donations, and we'll see how, you know, when we've had to cancel 3 events, how we're going to be able to make up the, you know, the donations, the funds that we thought we would get from those. And so it is a challenge, and, you know, it's just we have to look at it. Some of our development people have attended some of these virtual fundraisers, and we're getting some ideas from them. And so that's sort of where we're going. The other thing is the workforce. You know, I agree with when we're talking about getting the workforce back, we have a huge problem with childcare. You know, the childcare, you know, is able to open the centers, but the issue is parents are not wanting to send their children to childcare. They're not going to, you know, they're opening camps for essential workers, but I will tell you, none of our staff is willing to send their children to any daycare or camps or anything. And so we have people who can't work because they have no childcare. And so for us, as we open up, you know, that is a concern of ours. How are we going to, you know, if we're going to bring everybody back to the office or back to out working, how is that going to affect us? Are we going to have 50% of our workforce? Are we going to have 75? That's a hard one.
I really appreciate the survey, and I you know, I kind of like, I experience what the survey is talking about. So it feels good to see it and see that other people are experiencing the same thing. What's interesting to me, and an interesting point, I think, is, and as we work with our employers and our community groups, and the funding is definitely less, but the funding ability is still there. I think the issue for us is that, particularly like Kaiser's community benefits or other community benefit funds, or even the California endowment, is the fear around direction and where we're going. And I think they want to give more money, but they're not exactly sure what to do. And everybody's a little scared about that, of where the money goes. So for us, one of the recommendations or suggestions that I would make is the clearer that we are with our community groups around where direction, what we're going, what we're trying to accomplish, both short and long term, will free up more money again, because people feel just unsure about where to put their money right now. You know, should they put it immediately into food? Should they put it immediately into childcare or whatever, or into unemployment or whatever? But if they knew there was a plan moving forward, I think that would free up some of the contributions again and put us back on the right track. I think we all kind of suffered, like, you know, particularly like the community benefit funds that just suspended and said, well, we're not going to do anything for 2 months because we're not sure where we're going. But I think the money is there to still support our programs, the workforce, and other kinds of issues that we all work with.
Yeah, can I share 2 thoughts on that, Lindy, before we move on? So one would be, we also earlier, like I think it was the first week of April, maybe, we did more of just a quick and dirty Survey Monkey kind of survey of funders specifically who work in Contra Costa. We didn't get everybody, but we got, I think, just under about 20. And you know, candidly, I think this is a really active conversation in philanthropy, and you're right. I mean, there's mixed responses. I think a lot of foundations are honoring all of their current grant commitments, but not all. Some are not taking new proposals, some are. Many are trying to be as flexible as they can. I know the Lesher Foundation, as an example, is honoring all of our current grant commitments, but also saying we want to be as flexible as we can, because many of the programs we fund can't do what they would normally do. It's like not physically possible to do it, but this is mixed within philanthropy. And I think, candidly, you know, I won't be surprised to see, you know, a call to action in the report that sort of suggests to philanthropy, you know, you need to work on this because the need is tremendous, and recognizing at the same time, you know, the total amount of resources within philanthropy have gone down too. So just, you know, I think it's a tension. I think it's a healthy tension. I'm glad you raised it. I think it's really important. And I think philanthropy needs to be doing, you know, really important soul searching on that work. And I know that we certainly are at the Lesher Foundation on that, both honoring our current grants, but also doing COVID grant making that's on top of that, not sort of robbing Peter to pay Paul. But then the other thing I wanted to mention is what you were talking about what to fund is one of the things that's come out of a lot of these discussions that I think you'll see reflected in the final report is exactly what you were saying, which is that the work ahead is not just getting the puzzle pieces back to what we had and getting them back in place. The work ahead that might inspire and motivate not just philanthropy and funders, but sort of all of us together is, given the level of disruption, what is the work we need to do to come together maybe in new ways across sectors, across government, business, labor, philanthropy, community itself, and say, we want to build something better than what we had before. You know, we had levels of inequity or dysfunctional systems. We had a lot of hunger before COVID. We had, you know, issues around economic opportunity before COVID. So what does it look like potentially for us to come together and have a different conversation that's about a different future, just given the intense level of disruption that's happening? And I think that's something we've heard pretty consistently. How to do it, I think people have different views, but that something like that needs to occur differently in our community to do meaningful recovery from COVID. I feel like that's been pretty consistent. I don't know if that resonates with you given your comments, but that's what we've been hearing.
Yeah. Thank you, Melissa. This is Stephanie. So I just want to jump in I think it's important to realize that the health systems in Contra Costa County, all three, Kaiser, Sutter, and John Muir, did a very extensive community health needs assessment. And it's interesting because each of the health systems has their priorities. It's on the websites. We have new We have our implementation strategy. And COVID-19 exacerbated our findings already. So it's really about how we pivot, and not all health systems decided not to. I mean, we've honored our grantees, we've pivoted, John Muir, have provided some COVID-19 relief. So I guess I want to caution of using it as a blanket statement, because not all health systems did the same thing. Yeah. And it's a mixed bag, as Melissa said. So I think we actually do have a very clear plan. And I think all the health systems have a clear plan, and it's now just a matter of implementation. How it's implemented varies, again, amongst various organizations. So I guess I would just caution and make sure that for community benefit, because we're quasi-philanthropy, nonprofit, we kind of sit in both worlds. You know, I think it's important to know that every health system is doing things differently based on their organizational priorities and leaderships. And so, you know, just know that we work very collaboratively, but we are all individual organizations, very similar to what Melissa said about the foundations. So, yeah.
Hey, Lindsay, am I okay to talk? I just want to kind of touch base on a couple things. First off, on the comfort level of our society to engage, specifically was brought up here about parents being comfortable to take their kids to daycare. That's just one example of an impediment to a positive growth in our economy. To me, this is an issue that needs 100% advocacy all the way up to the President of the United States. And I know that sounds weird, but it's true. The way other countries have got past this problem is by holistic testing. Testing gives everybody a comfort level to re-engage. We're not doing that. Other countries have done it successfully, so I won't get on a soapbox for that, but if East Bay Leadership Council sees that as an impediment to letting other peripheral entities move faster and to get the economy to grow, we need to be hitting that hard with all of our politicians, number one. Number two is with respect to the fundraising and nonprofits. I've been on both sides of the fence for many, many, many years, on the giveaway side and on the request money side. And one thing that I've learned, well, actually two critical things that I've learned, is giving is very emotional, which I believe Melissa and Pete, you touched on. You have to believe in what you're giving to. And also, big money donors want to see efficient organizations. It's just like investing their money in the stock market. They want to see a return. When they invest money in a social support system, they want to see return, right? And as Melissa stated, we need to look at different ways of doing things in this environment. Again, that's the iceberg theory. We've had problems in our nonprofit world where a lot of people ask for money, and there's a lot of, you know, I hate to say this, but it's true. There's a lot of repetitiveness in nonprofit work. So our nonprofits, I think, need to work to get together and do joint fundraising. Somehow that has to happen, because if you piece this together all the way through, there's going to be big winners and a lot of little losers. And Debbie, I think what you need to be part of the big winners, right? Because nobody's seeing what you're doing, but other people in the industry see it. So that's one. The last thing I wanted to bring up is the domestic violence thing, and back on advocacy. We all know it's happening, but if you look at our police forces, they're not going out, right? Our police forces, everything that I've seen, they're not arresting people unless very bad things are happening, and people know that. So we need to find a way of expressing to our police forces that there needs to be more engagement and more public awareness on how to get people through these things if they're not able to go out and be there for them. So those are the 3 points I wanted to make.
Thank you for sharing your thoughts, Dennis. I appreciate that. And I know that it's after 10:30.
One quick thing about Dennis's point, I just want to share, there is a conversation going on around your point about nonprofits, because I think the brutal reality is we know every nonprofit probably will not survive COVID, just like every business will not. I mean, this is just an ugly, brutal reality. And even some really wonderful, important, doing incredible work nonprofits. It's, you know, I think just the circumstances are such, but there is some conversation going on around, given that finding on both fundraising and scenario planning, like, is there some sort of a resource? I think of it as a hub that sort of nonprofits could tap into to have the conversations around, well, maybe I don't want to merge, but I think there's 5 other organizations kind of like mine where maybe we could enter some sort of deeper partnership, or actually maybe I want to look at some sort of vertical or horizontal merger, or I want to think long-term strategically, and I think this organization might be in the same space, but I need some consulting support to help work that through. I don't know if that will come together, but there is some discussion around that and what could that look like and what would be useful. But my sense too is that there's going to need to be some explicit resources and support for nonprofits to do that kind of work, because every dollar they have right now, they're utilizing just to keep going with what they're doing. You know, that's just realistic to think they're going to come up with funds from their regular ongoing operations to do that kind of longer term sustainability consideration.
You're exactly right, 100% right. And I know, I'll share one more thing. You all know I worked on the Naval Weapons Station for a long time, and as of right now, that's just a dead issue. And Pete, you and I talked about this many years ago, where we wanted to do what you're describing, Melissa, is create a hub of strategic leadership within the confinements of that. I think that concept still exists, and it still needs to be worked on now more than ever. So if there's anybody working on that, or if there's anybody that wants to work on that, Melissa, if you could connect me to somebody, I mean, it's not part of my job, but I'd be willing to help with it.
Yeah, for sure. There's no there yet, but I feel like it's talk in the air. So
well, let's create it. I mean, yeah, somebody has to.
I think nonprofits have to want it though, right? So I think that's what we have to figure out.
Yeah. Thank you for your comments.
I don't think it's that we don't want it. You know, I don't think that that's the issue, to be fair. I think right now, I don't know about other nonprofit leaders. I'm literally working 80 to 100 hours a week. That's
yes,
just
and I include that in
right
want, like want as in like it's meaningful to you right now. Like it has to be useful, right? Or it's I should have said it better. I think philanthropy suggesting something like that and resourcing it, if it's not done in a way that works for nonprofits, makes it not useful, right? Like
correct.
It has to meet.
Correct.
And
correct.
Debbie, I think you're saying it. I think you're
useful.
actually saying it. Sorry.
That's all. I totally agree, Debbie. It can't be structured in such a way that it's not actually useful given the realities, right? Otherwise it's not purposeful.
Yeah.
And my point to you, Debbie, is I think you're saying it by saying, look, I'm buried. There has to be a better solution, right? You're not explicitly saying, let's have this solution, but you're saying, let's get some people together and figure out a better solution so I don't have to kill myself and other people can benefit from the work that we put together to have a better strategic plan for nonprofit fundraising and execution.
I agree. I mean, the thing is honestly that the system currently is structured such that it takes people who are going to die to run their organizations to keep them going. And the expectation of the greater world around us is that that's okay. And it's really not okay. It's not expected that anybody in any other industry works 80 hours a week and doesn't pay attention to their family and doesn't sleep and is unhealthy because they have to put every waking moment into trying to salvage a program that's serving frail people, whether they're elderly, whether they're abused, whether they're whatever. I mean, so we have to change something, and maybe that's in developing better networks and collaborating together on fundraising, or I don't know what the answer to it is. I just know that it's a crappy thing and it's not sustainable. So yeah.
Thank you all.
Anyway, we're way over, sorry.
Yeah, any efforts to address that have to take that reality into account, I think is what's important too.
I think it's great that we're having such a great conversation, and perhaps this is something we'll bring to the next June meeting as well. But I do want to respect that I know there's some other calls people need to get on. And I want to thank you all for your time. Cindy and Ashley, is there anything you wanted to say to just wrap us up? No? Okay. Well,
thank you, Melissa, though, for joining us. That was incredibly helpful.
Yeah, I really appreciate that.
Yeah, great discussion. Thank you guys.